Hello, this is Mr. Nolan, and I'm from Graduation Alliance, health and fitness instructor, and I'm going to be speaking to you about lesson 3.2.1, which is from Health Semester 1. And this lesson is talking about prescription drug abuse. Prescription drugs are legal when obtained only with the prescription from a doctor. The, the drug is only legal when taken by the individual it's prescribed to and for the reason it was prescribed. When someone who is not prescribed a medication takes the drug in an inappropriate way, such as to get high, this is considered prescription drug abuse. Three classes of medications most commonly misused. We got opioids, usually prescribed for pain, central nervous system CNS depressants. This category includes tranquilizers, sedatives, and hypnotics. These are used to treat anxiety and sleep disorders, and stimulants, which are most often prescribed to treat attention deficit hyperactivity disorder, otherwise known as ADHD. Prescription drugs. Doctors who prescribe these medications take their possible side effects into consideration before recommending a patient use the drug. When a person takes a prescription medication that was not prescribed for them, the side effects may be harmful or even deadly. So it's very important that individuals only take prescription medications prescribed to them. These side effects can be worse when taken in combination with other substances, such as alcohol or other drugs. This is sometimes referred to as the multiplier effect. The multiplier effect is the result of mixing multiple drugs together or mixing drugs with alcohol, which usually leads to heightened intoxication. This can be extremely dangerous. Over-the-counter medications, such as cough and cold medications, are some of the most commonly abused over-the-counter medications. Over-the-counter medications are available pretty much everywhere, can be purchased without a prescription. It's important to understand how to use these medications. It's also necessary to read labels to know what side effects a drug may cause, to know what an appropriate dosage is to avoid overdose, and to know which drugs not to combine with certain medications. Just because a drug is available over the counter does not mean you still shouldn't follow the instructions on the label. There are many risks involved with taking over-the-counter drugs. In fact, some of them can even be habit-forming or addictive when not taken correctly. What's on the label? So looking at a label of an over-the-counter medication, we see a label right here for an antihistamine. So we look at the active ingredients, which is going to show up here on the top. This is the therapeutic substance in the product, the amount of active ingredient per unit. So this is the ingredient that's going to help with our symptoms. Uses, next section right here, symptoms or diseases that product will treat or prevent. And then you have a list of warnings in the next section right here. When not to use the product, conditions that may require advice from a doctor before taking the product, possible interactions or side effects, when to stop taking the product and when to contact a doctor. If you are pregnant or breastfeeding, seek guidance from a healthcare professional. Keep product out of children's reach. The next section, we have inactive ingredients, which is located down here. These are substances such as colors or flavors. Purpose, the product action or category such as antihistamine, antacid, or cough suppressant. So in this case, this is an antihistamine. Directions, specific age categories, how much to take, how to take, and how often and how long to take. So you got your directions right here based on age. And then other information, possibly on a label, how to store the product properly, and required information about certain ingredients, such as the amount of calcium, potassium, or sodium the product contains. So that is an overview of prescription drugs and over-the-counter drugs. This information is going to help you complete lesson 3.2.1. If you have any questions, reach out to your health and fitness instructor. Have a great day.